I came up with this topic based on the presentation by Shin about blockchain. I was really fascinated by the fact that government is using, or it's using more now than before, the technology of blockchain. And I would like to also obviously emphasize how COVID-19 has impacted the way government is assessing the use of this technology even more. So blockchain has attracted governments for two main reasons. First, it strengthens security by its very design. It involves multiple servers rather than one. New blocks of transactions cannot be added to the chain unless a majority of servers allow the transaction to occur. In contrast to existing technologies in government, which can be manipulated if a hacker can pass through a single point of security. Another reason government looks into blockchain is the increased transparency and auditability. As government entities add transactions to a chain, anyone can check the blocks and make sure that they contain the correct information. So I would like to obviously discuss the opportunities and challenges on this technology currently faced by government. The distributed ledger technology, such as blockchain, allows users to carry out digital transactions without any need for a centralized unit, as mentioned before. It could fundamentally change the way government conduct business. Among the opportunities that are being assessed are the efficiency, as it reduces or eliminates the need for human workers to track data, the transparency and immutability, because any user can view the ledger. It may result in benefits such as reduced corruption. The accountability is another aspect that they really like, as transaction information is automatically generated by a computer, which may reduce errors, thus providing better quality and reliable data. There's also a wide applicability within government, and it's being explored for use across many areas, including grant management, supply chain and logistics, vital records, and healthcare, of course, with COVID-19. Among the challenges that are being considered is the excessive energy use. Some technologies in blockchain can be costly to operate because they require large amounts of computing power and energy to generate new units. This is the case of cryptocurrency. So it's a very big controversy in relation to this. Security is another challenge. Entities using distributed ledger technology will need to ensure data stored on a premise distributed ledger is not accessible to outside actors. It's a huge concern, obviously, by government. The permanence, while it is a core strength of the distributed ledger technology, it can also be a weakness should an entity find that it needs to regularly correct errors in its ledger. And it would not be easily done with this technology. The lack of transparency because of distributed ledger technology can be used without a central authority. Governments may feel uncomfortable allowing cryptocurrencies, for example, to be used as a method of exchange or contracting, since they cannot easily be tracked or could be used to facilitate illicit activities such as tax evasion or money laundering. Next one. So, prior to COVID-19 application, there was no highly visible blockchain technology being used by government. However, as you can see on the graphic, blockchain can be used in many areas. The questions that government officials are making and still debating on are, as you can see, taxation, legal enforcement, legislation, records, bills and payments, welfare distribution, digitized aids, cyber protection, security and safety, taxation, and healthcare. For the purpose of this presentation, we'll explore healthcare and its applicability to COVID-19. The questions that government are actually asking right now is what situations is useful and when should it be avoided or used with caution? To what extent can it be used to facilitate illegal activities, and how might policymakers mitigate such use? And how are government agencies evaluating and use it? Okay. So COVID-19, as we all know, has impacted countries in countless ways. As governments scramble to address these problems, many different solutions based on blockchain technology in healthcare have come to life to help deal with the health crisis. COVID-19 has brought many challenges to government. One major issue is how prepared the world's health system were to respond to this outbreak, and to our extent and of knowledge, it was very minimal. The tracking of huge population of infectious patients to stop the epidemic has been a challenge as well. The immediate requirement for developing better diagnostics, treatment, and at some point vaccine is a major area of focus for government on the continued exploration of this technology within the system. Another one, next one. Okay, so just a couple of weeks ago, the Health and Human Services opened a blockchain platform called the Coronavirus Data Hub. And I provided the link there, and you'll be able to actually access and be able to actually gather a lot of data from government and obviously private institutions. It is a more comprehensive than it was previously offered by the CDC. It provides a lot of data in regards to the hospitals. In fact, about 6,200 hospitals across the U.S. have been able to be linked to this data, and about 4 million dispersed data elements are included, including the race, ethnicity of patients, and hospital supplies and bed space. It's actually very comprehensive. I want to look into it, and it in fact has a lot more information than the health data.gov. Okay, so I found this really interesting as you know, the concept of blockchain in my mind was not visualized on how it has been fully implemented in the COVID-19 management. The world has never seen anything like it in recent history, so we need to take a look at how the reporting infrastructure available for infectious disease is being processed. There are now various blockchain applications in fighting COVID-19, and these include, as you see on the graphic, the tracking the infectious disease outbreaks, which enables government agencies to keep track of various activity of patients, suspected new cases, and much more. It could be used for crisis management by instantly alerting the public about the coronavirus. Global institutes like the World Health Organization using contract concept. It could also offer a secure platform where all the concerning authorities in a country, such as governments, medical professionals, and health organizations, can update each other about the situation and prevent it from getting worse. It could be used for securing medical supplies. For example, blockchain could help streamline medical supply chains, ensuring that doctors and patients have access to medical tools and equipment whenever they need. And lastly, donation trackings. Donors can see where funds are mostly required and track their donations until they're provided with a verification that their contributions have been received with to the victims or the organizations that they are managing the funds. It can also enable transparency for the general public to understand how their donations have been used and its progress. So the future of healthcare with blockchain. You know, back in 2018, the American Council for Technology and Industry Advisory developed a guide to support governments in its understanding of blockchain and distributed ledger technologies. However, not until recently with the COVID-19 crisis, the U.S. is turning a corner with this technology. We have first tried to analyze, how blockchain platform helps prevent early detection of pandemics and fast track the impact of management of outbreaks and treatment. Okay, I mentioned that before. So with blockchain technology in the COVID-19 crisis, it actually disseminates in real time large amount of data. The efficiency and accuracy is a higher degree of transparency. It's something that has been useful for government tracking and implementation of this technology across different departments and agencies. It has not been the case for previous sectors until now. And as I mentioned before, in 2018, the American Council for Technology and Industry Advisory Council developed a playbook to government so that it can understand how blockchain can be implemented across different agencies. You can actually access the white paper on that link. Okay. Here, I would like to briefly go over, this is actually found on that website, should you access the white paper. It allows, this graphic allows for you to understand how federal government is determining the implementation of blockchain as is instructed by the ACT-AC. It actually looks into the assessment, determining if blockchain is actually the right technology to solve the problem, readiness, and prepare the organization to be able to use it. Selection, in which areas it best meets the use of blockchain, eventually the implementation solution, and the integration overall within the agency. So in conclusion, blockchain can share transactions information in real time in a secure and immutable fashion. It is now being embraced by government, not only here in the US, but in other countries as a reliable opportunity to, improve the infrastructure and reporting. And it's being analyzed not only from a technological perspective, but also policy. A lot of policy and bills are being actually considered now and in Congress for passing. A lot of controversy in the past have been put in the light of cryptocurrencies, and I think that's the main reason why blockchain has not been, widely accepted by government overall, at least here in the United States.